I didn't know that I wanted to be a doctor growing up, but I knew that I wanted to be a teacher. And I think it's very interesting that life's path has led me really to do both. I really have the best of both worlds where I can impact health of the patient and the community, but also be able to teach the next generation to do the same wherever they are going to be working someday in their future career.
I think it was easy to be intimidated by the idea of what Dr. Aring brought when I first started residency, because she was seen as a very experienced physician who did a little bit of everything. And I really enjoyed my early interactions with her because she was always maintaining a mindset to teach.
Dr. Aring provides education here that is patient-centered and relevant. She's not someone who just goes along with algorithms all the time. She's definitely the attending that I turn to when I have a tricky clinical situation, like a patient who doesn't fit inside the boxes, and a situation that's not just black and white, because she is so good at thinking outside of the box and coming up with solutions that a lot of people would struggle with.
When you're working with her as a student or a resident, you can't help but kind of get swept into what family medicine is in that relationship. So as an educator, she doesn't even have to pull out all of her faculty development tricks that we learn in order to teach students and residents well, because it's just innate in her that she's a family doctor. And it's almost through osmosis in a way that you understand as a student or a resident what family medicine is and what that continuity of care really looks like.
Countless times she's always going above and beyond for her patients, and she's really taught me that we've been blessed to be in a field where we're able to take care of people at their most vulnerable state, with their health and caring for them, and so never to tire. There's been times when I've been tempted to say, well, I'll put something off to tomorrow, but with the things that Dr. Aring has taught me, and just learning from her example, I always am encouraged and to put the patient first.
She is committed to everything she does, particularly her passions of delivering babies.
So most days I have a blend of teaching and patient care, seeing my own patients and administrative responsibilities, but my true love is delivering babies. In fact, I've been delivering babies for so long that I have 3 families where I've delivered a second generation, meaning that I have delivered the mother or the father, and then I have delivered their baby, and those are families that are very special to me.
Dr. Aring is a great educator in this office because she has expertise that others don't have. She has had 12 years of experience with addiction medicine. That has become more important in our practice as we have created an addiction medicine clinic.
A few years ago, I had a patient named Marianne that on physical exam, I noticed that she had track marks. And when I talked with her, she disclosed to me that she was a heroin addict. And at that point in my career, in my education, I really had very little knowledge of addiction medicine, and I felt that I was not very well prepared to take care of her because she lived in a world that I just didn't understand. So because of that patient encounter, I have developed an interest in addiction medicine and now train the residents and faculty, and also have given even some national conferences promoting addiction medicine in the treatment. So if I had to pick one thing that I was passionate about with family medicine, it would be addiction medicine and helping that very marginalized population in our society get quality medical care.
Before addiction medicine was really a known specialty, she was practicing addiction medicine, and before it became the hot topic that everyone's talking about, the opiate addiction, she was out there on the front lines taking care of patients because she saw a need in her community. And the fact that she continues to develop her skills and think about new ways to care for patients and to care for them better while maintaining her full scope of practice and teaching residents, I think is truly remarkable and really deserving of this award.
I chose family medicine because I wanted to take care of the whole person throughout the lifestyle. And as a family doctor, I have the opportunity to prevent disease, educate people about disease, and help them manage their disease. My philosophy is to partner with the patient in order to help them achieve their goals. What I might feel is important may not be what the patient may feel is important, so that's why it's very important to partner with the patient so that we are able to affect the health in a very positive way to get the best possible outcome for them.
She's a very caring individual. She, genuinely listens to what we have to say, about whatever we've come in to see her for, and it is a very enjoyable thing to actually come see a friend as a physician.
She's just like it's all in one package. You know that she's going to believe you, she's going to guide you, you feel like you can trust her, she's going to give you the best care she can. And Dr. Aring's also treated my mother, who passed away in March, and so I got to see her from a different perspective as well, helping to care for her family, and it's great.
Yeah, she's very special to us.
Dr. Aring is a quiet leader. When I see her with students and residents, she is very compassionate, not only in teaching her compassion toward patients, but her compassion for the residents themselves and her students. And that's one of the reasons that she is a great educator, because she can say so much without saying anything.
She sets herself apart by leading first with her actions, and not just with talking, but with walking the talk that she expects all of us to do. In everything she does, she is genuine, and she puts the truth at the forefront.
She's just such a strong role model in this, and it's amazing to think about how many lives she has actually touched over the years in terms of patients that she has helped to care for, but also physicians that she has trained. And so her voice is out there, and it's with all of us who have trained with her. It's very inspirational to work with her.
My name is Dr. Ann Aring, and I'm a very proud family physician and an even prouder family medicine educator.